Hello, afternoon. Good afternoon. Hello, Delan.
Yes.
Hi.
Hi,
Hello.
how are you? Hello, Professor João. Thanks for both of you for participating. It's a great honor and a privilege. And we have a large audience on virtual contact, which is in some extent it's a pity because interacting directly is another world. I thank you very much for taking your time and being so kind to join us in this effort. Without um, further saying, I would like to ask Professor Delan Devakumar uh, to start the presentation. And if you have the time to stay and also listen to the presentation of Professor Fernandes, and I think in the end we will have a short discussion that eventually will put together the two concepts that are going to be discussed. Thank you very much again.
Okay. Thank you. And let me share my screen. Is that okay? Can you see my screen?
Yes. Yes.
Yeah. So thank you very much for inviting me to speak today. It's an honor to be speaking to you all, and I apologize, my Portuguese is very bad, so I'm going to stick to English. So my name's Delan Devakumar. I'm a professor of global child health in University College London, based in the Institute for Global Health. And my talk is going to be on, sorry, I'll just, my talk is going to be on racism and xenophobia and the impact on health. So the work that I'll present is primarily related to two publications and one that is upcoming. So the UCL Lancet Commission on Migration and Health, which was published in December 2018. The Lancet series on racism, xenophobia, discrimination in health, which was published in December 22. And then a little bit, I might mention on the Lancet Commission on Racism in Child Health, which is the current work that's ongoing. Broadly, I have three key messages that I want to present, which led to the work on racism. And one is for people working in health professionals, academics, to have a wider recognition of racism, xenophobia, discrimination as determinants of health, to be considered alongside the other big determinants of health. If you think about the environment, climate, socioeconomic status. The second is that this is a global health issue. There are similar drivers and consequences based on the similar issues of caste, ethnicity, indigenous status, migratory status, race, religion, skin color. These are issues that happen around the world in every society. Different groups may be persecuted and affected, but there are similar health consequences across the world. And finally, to focus on structural issues. It tends to be that people think about racism, they think about interpersonal racism, they think about how it may affect the individual. But I'd like to take a step back and to think about the structural causes of why racism may happen. So the work on racism specifically started in 2019, and that's before the global discourse increased on this topic. And two major things happened in 2020. Of course, the COVID-19 pandemic. We saw early on targeting of East Asian people in many countries around the world, the labeling of the coronavirus as a China virus, for example. We saw ostracizing of migrant groups at borders, keeping people out. And then the murder of George Floyd, and then the subsequent Black Lives Matter protests around the world. But it's important to say this is not about the actions of a single person. This is about the deeply rooted systems of oppression that result in the deaths of innocent people. And if we look at COVID-19, so this is a graph from the Office for National Statistics in the UK, and this shows COVID mortality in England in the first and second waves in England. And what we see is, compared to the white British group, Bangladeshi women had a 4 times increased mortality. Bangladeshi men then had a 5 times increased mortality compared to white men. And we see this stepwise increase for Pakistani groups or Bangladeshi groups as Black African, Black Caribbean groups, all with higher mortality than the white British population. And why should this happen? Because these are people living in the same country, living in the same societies, the same health system, but we still see this difference, stark difference. And it comes down to a few different reasons that are structural and institutional in their cause. People from Black, Asian, minority ethnic groups, as a way of defining groups in the UK, are more likely to get infected in the first place. People from Pakistani, Bangladeshi groups more likely to work in the service industry, for example, to come in contact with the virus. Black people more likely to work within healthcare, not to come in contact with the virus. More likely to live in overcrowded accommodation, meaning the virus can pass from person to person more easily. They're more likely to have barriers to access the health system. So barriers, charging barriers, for example, issues around understanding the health system, issues around language. So when they present later and in a more unwell way. And they're more likely to have underlying non-communicable diseases, meaning that when they get COVID, they become more unwell and are more likely to die from it. So there are multiple structural causes that lead to individuals becoming unwell and dying from this novel infection. So what is racism? We define racism as an organized system that affords power and privilege according to an established hierarchy. And racism operates to protect those at the top of that hierarchy, to protect their rights, power, livelihoods, usually at the expense of other people. Xenophobia is a similar concept, but fear, hatred, discrimination of those who are considered to be foreigners. And then finally, discrimination, so differential treatment or outcomes that are unfavorable towards a group or an individual based on their identity. So for racism to exist, we need racial categories. And this goes back to the 1700s to Johann Friedrich Blumenbach and Karl Linnaeus, who described groups of people. And it's important to say these are social categorizations. These are not based on biology. These are based on the opinions of these two people. Blumenbach described the colors, many of which are commonly still in use today. Linnaeus went a step further, though, to talk about different groups and characteristics of those groups. Americanus being choleric, obstinate, Asiaticus melancholy, haughty, Africanus indolent, negligent, Europeanus being sanguine, muscular, inventive. There was an implicit hierarchy within those different groups, with the European people, the white people being above the others. And this has played out throughout science and throughout medicine. One example is eugenics. And I say this as a professor of child health in University College London. UCL was the scientific home of the eugenics movement. Francis Galton coined the term eugenics, in fact. Francis Galton, famous scientist, statistician, followed by Carl Pearson, who worked in eugenics as well. So according to Galton, eugenics deals with what is more valuable than money or lands, namely the heritage of high character, capable brains, fine physique and vigor. It aims at the evolution and preservation of high races of men. We're dividing people into two distinct groups, those who are worthy to give life and those who are not. UCL has recently looked into this issue. There was an inquiry into the history of eugenics in UCL. And one of their statements, this is a quote from the inquiry, that really goes to how eugenics is still prevalent today. Around the world, eugenics of one form or another is implicated in compulsory sterilization, legislation on mental deficiency, immigration law and racist policies, the notion of natural intelligence, normalization of segregation by race, ability, and class. And one of the most famous examples of racism within healthcare and science and medical sciences, the Tuskegee study for syphilis. And in this study, which Black people were specifically targeted in southern states of the US. So the study had 600 Black men, about 2/3 with syphilis, 1/3 without. And the study was designed to look at the natural history of syphilis. So without proper informed consent, these people were monitored over time. And they were given some things, free exams, free meals, burial insurance, but not told about the real reasons behind the study. And this is important because the study started in 1932. By 1947, syphilis was a recommended drug of choice. But the participants were not treated for syphilis until the study stopped in 1972. So being an infectious disease, the people became unwell, but also passed it on to their wives. Children were born with congenital syphilis. And this, importantly, this prompted a change in research ethics and research laws, and the idea that informed consent, participants have to be taken care of within studies. So I'm going to talk about our conceptual model. So to think about racism in multiple levels, and this starts with the individual. So the individual, we can think about multiple stages of life and how racism can affect health. So even at birth, there are associations with babies being born with low birth weight, small for gestational age, adverse perinatal outcomes. We see in childhood asthma, depression, malnutrition, that progresses into adulthood, increasingly non-communicable diseases, increasing cancer risk. Then in older life, cognitive decline and mental illness. And there are primarily behavioral, psychological, and physiological pathways that this can happen. This was described by Yin Paradis in a systematic review, who described broadly these three ways in which racism can affect health. There's the bottom pathway, which is maybe the most obvious. People think about assault, that people can be physically hurt from a racist attack. The top pathway, denial of services or goods, certain groups excluded from the health service. But there's a middle pathway as well, these physiological pathways by which stress, an increase in stress, and what we call toxic stress, or the idea from Arlene Geronimus of weathering, repeated chronic stress above what the body can cope with. And this leads to overregulation of hormones, neuroendocrine system, the activation of the immune system, chronic inflammation. We get these epigenetic changes to the expression of DNA that can result in physical changes to the body's biology based on activation of the stress response. So in our review, we looked at the many different ways in which racism can affect health. And this is not specifically to read the slide, but just to show that there's a huge number of studies covering lots and lots of different conditions throughout the life stages, from birth to older life. And going back to our migration work, so one thing we tried to do in our migration commission was to look at the ways, some of the myths around migration, and try to challenge some of those myths. So one of these was that migrants are disease carriers who pose risks to resident populations. The reality is that migrants are more likely to become unwell themselves, and the risk to the general population is negligible. But it's a way that the health system treats migrants that results in them becoming unwell. A systematic review by my colleague Rob Aldridge looked at almost 100 studies with 15 million migrants across nearly 100 countries, and found that the standardized mortality rate was actually lower for migrants than the host population. Migrants tended to be healthier, and in many ways that makes sense. Migrants are people who can move from their places of origin. We saw similar numbers for male and female migrants, slightly lower mortality for refugees. But importantly, certain subgroups within that, so mortality from, I think, infections, from violence was higher amongst migrant groups than other groups, but overall mortality was lower. We then thought about the communities that people live in. And communities can be protective. They can protect the person from the effects of racism. They can also propagate racism. We can see communities that ostracize people. And another thing that's important to think about is that communities are not necessarily physical entities. They can be virtual. Increasingly, there are virtual communities. Thinking about young people that can be targeted within those virtual communities as well. We then thought about the physical spaces that people live in and the consequences of the environment. There can be issues like air pollution. There's been a debate in London, for example, on high levels of air pollution. And certain people, Black communities, are more likely to live in parts of London which have high levels of air pollution. We did a review on this topic that was published last year and found that racially minoritized groups, migrants, indigenous communities, are more likely to face the impacts of climate change, despite contributing less to this. A study looking at carbon dioxide emissions, for example, found that the global north, making up 14% of the world's population, are responsible for 92% of historical CO2 emissions, in excess of safe planetary boundaries. And these graphs, again, it's a little bit difficult to see, but the top graph is the carbon dioxide emissions, and the four bottom graphs are where the consequences lie. And we can see very distinctly that the countries in the north, the rich countries, have emitted more CO2, but it's the countries, the global south, that are facing the negative consequences of climate change. And if you're interested in this topic, I'll have a link to our Race and Health website at the end, where you can look up our work envisioning environmental equity, where we speak with young people in Brazil, Uganda, the Philippines, to talk about the issues that they're facing. So moving on to the structural causes. So as I said at the start, I'd like you to think about the structural reasons around which racism exists. And we described two different phenomena, one of separation and one of hierarchical power. The idea of separation, which arguably is natural, that humans like to separate into groups, like to compare one group to another group. And this happens very commonly, happens amongst sports teams in the same city, for example. But then the second part of that is the hierarchy. That is not just groups separate, these are put in a hierarchy where certain people are deemed to be above other people. And these structures have been these structures can result in changes to laws and the way societies are governed. I guess most famously the apartheid regime in South Africa, the Jim Crow laws in the USA that segregated certain states. And the structural causes are really the reasons behind why, behind the health consequences that we see. So one of these structural causes is in migration, where we deny migrants on the grounds of public health protection. And we argue that this is not supported by the evidence. So thinking about migration journeys for a moment. When I started this work, I would think about starting from a place of origin, moving to a destination. But really, a transit phase can be very long, can be very problematic, traumatic sometimes. Sometimes transit is very short, that people may get intercepted and sent back to their place of origin. In the case of our new Rwanda bill in the UK, asylum seekers coming to the UK can be sent directly to Rwanda to be processed by the Rwanda government. We can have these very long transit phases where people may be stuck within an interim phase for years or decades even. And there are numerous health consequences related to this. The International Organization for Migration described these many different ways in which the adverse health consequences along that journey can affect people, from nutrition, from hypothermia, injuries, gastrointestinal effects. So if we think about health restrictions on entry, mobile populations often met with punitive border policies, arbitrary detention, abuse, extortion. We did a systematic review that showed that detention is associated with negative health outcomes, especially mental health. And migrants, including young children, can be detained. So we would argue that restrictions are impermissible on public health and human rights grounds, that there's the right to the highest attainable standard of health applies to all people, not just residents. And integrated migrant populations will actually benefit entire communities and be better for everyone. But underlying this is the politics and the increasingly populist politics that are designed to identify, to scapegoat other people, to target other people. And this is coming from some of the biggest leaders in the world, the most powerful people in the world, are coming out with populist politics that scapegoat certain groups. So finally, in our conceptual model, we thought about the ways in which those structural determinants result in the health consequences, and that's through the health systems. So again, one of the myths around migration are that migrants are a burden on services. What we see that in the UK, for example, migrants are a gain to communities. About a third of doctors within our National Health Service graduated in a different country. The NHS, the National Health Service, is hugely dependent on foreign staff and would collapse without the influx of migrants upholding the national institutions. Migrants also contribute to economies. They work in the communities that they go to. They increasingly, with demographic changes and aging populations, migrants, young adults are needed. We then map the different ways in which racism can exist within a health system. And there are numerous examples here. There are examples of discrimination by health workers. There can be discrimination towards health workers as well. But importantly, there can be many ways the health system is set up that doesn't actively discriminate, it doesn't deliberately discriminate, but can do in the way that the system is set up in terms of language, bureaucracy, physically where health institutions are based. It could be issues around algorithms within healthcare that automatically correct for race, kidney race corrections, for example. So there are many ways the health system can be set up that is racist, and that isn't about an individual person. This is about the structure of the health system. And one example of this is within the UK, where undocumented migrant children can be excluded from health services. So these children who don't have the right documentation to prove their immigration status, there are around 120,000 children such as this in the UK, about half of whom are born in the UK. And in the UK, those migrant children are charged for secondary care treatment in hospital up to 150% of the normal tariff. And if there are debts, those people can be referred to the Home Office. So these are people who deal with border control. So what does this mean? What are the results of this? The children may not be treated for the illnesses they should be treated for. They may present late. Parents may rightly be worried about going to see the doctor. Newborn care, for example, is charged. Antenatal care, average cost of £6,000 per delivery is charged. And even for safeguarding issues, so trafficked children are excluded from this, but it's difficult to know who's a trafficked child often, so there might be charging issues initially. And then finally, we added a ring around this to indicate the life stages and an arrow indicating intersectionality. Sorry, my computer froze. So one example here is on unaccompanied minors, a review led by my former PhD student, Susanna Corona-Maioli, who looked at unaccompanied minors who are individuals traveling without the parent or adult who's responsible for taking care of them. And we found numerous examples of health conditions, physical conditions, nutritional deficiencies, infections, low vaccination state, and lots of mental health issues. And this is related to those difficult transit journeys that people take, but also the discrimination faced on arrival at their destination. And our third paper looked at intersectionality. So we described case studies from around the world and looked at different types of discrimination and tried to include this idea of intersectionality where an individual has multiple identities that come together, and discrimination can be a confluence of all of those identities together. We described the many similarities or differences between these different cases around the world. So noting that history, colonial influences are important, the ideas of separation hierarchy, as I mentioned, institutionalization, particularly in our Australian example, and violence, direct violence, but also structural violence that affects people. And then our last paper looked at what should be done. So we tried to map interventions from the individual level to the structural level. I think it's fair to say that most of the interventions tend to be individual. They tend to be quite short-lasting interventions. The ones that were probably more effective were the structural interventions where we can change what happens in a society. We've then applied this approach to different settings. So this was, again, our climate change work where we looked at discrimination at these multiple levels, what the problems are, what can be done. And I often come back to this idea of action must be multisectoral, society-wide. We have to focus on that individual person affected by racism, the child who turns up to an emergency department. But to focus only on that individual misses the bulk of the problem. And so we also have to look at the institutions, the communities, the structural causes, and try to make changes at all these levels. And then we came up with these 6 key principles of decolonization, taking account of intersectionality, increasing diversity and inclusion, reparative justice, focusing on an anti-racism approach, and taking a human rights approach. And I feel that these kinds of approaches can be applied both to practice and also to research. And I want to end with one final quote. So this is focusing on migration again, on illegal migration and how it affects children. So this is a new bill that we have in the United Kingdom. And I give this quote because it's very easy to say, this is not my problem. This is for other people to deal with. These are political, structural issues. So as health professionals, we have a duty of care for all children. We cannot be silent bystanders to overtly health-harming policies. With threats of deportation and detention looming, we've never experienced a time more critical to deliver compassionate, trauma-informed care to children seeking asylum. But it's not enough to simply treat the child's medical conditions. As trusted health professionals, we can articulate the devastating circumstances these children have come from and make the case for their ongoing needs. We must challenge policies with evidence, engage decision makers in discussion around social justice, and participate in advocacy actions. Our patients trust us with their stories, and our response to such a privilege cannot be passive listening. We must both hear and act. And finally, I want to play a short animation. It's very easy for me to talk to you in conceptual terms about racism, about conceptual models, interventions. But racism is a very personal thing. So one thing we did, we posed this question: what does racism mean to you, to individuals around the world? And we put this together.
Racismo para mí significa definir a otro como distinto y diferente a mí, de una manera tal que vale menos como persona. Por ejemplo, en Chile, donde yo vivo, crecí en una familia donde el tener color de piel blanco, ojos claros o color de cabello claro tenía mayor valía, y yo, siendo morena, sentí desde muy pequeña que yo entonces era menos bonita, o lo que decía o pensaba importaba menos. En el espacio profesional también he sentido experiencias de ser definida como menor valía por ser latina en Europa, lo que hace que uno viva la vida desde un lugar de más miedo, de mayor inseguridad sobre lo que piensa, hace o dice.
Racism to me is the beauty standard that we have in Samoa. If you look more indigenous or local, people will treat you in a way that is less than they would treat a foreigner.
My first awareness of racism was as a young brown child visiting the UK. It was to feel judged or watched every time I went into a shop or boarded a bus. It was to know implicitly that I was considered to be a different category of person than the members of a more powerful majority. It was to feel that I had to be an exemplary representative of my minority group who was deserving of acceptance, and to know that I always had to be alert to my precarious position. When I returned to live in Sri Lanka, my situation was completely reversed. I was privileged to be a member of the majority, and it was my neighbors, friends, and colleagues from minority groups who lived with the very real possibility of violence that could threaten their homes and lives.
I recognize racism in our school systems, but in the form of colonialism. As a Ghanaian citizen, we were colonized by the British, which means that we had to adopt the British education system. However, years after we have gotten our independence, we are still, to a larger extent, being taught with the same education structure, which to me feels just not right. To a larger extent, the education that most Africans are getting is still colonized, so it makes it very unrelatable to young people.
Racismo é que é errado a gente falar mal da pessoa só por jeito que ela é. É muito errado. Então eu ia falar para a professora quem tá fazendo racismo, para ela conversar. E é isso.
So thank you very much to everyone who spoke in that animation, and to Meet who put it together.
Dear
And
Delan, thank you so much. It's an inspiring presentation. I will now pass to Professor João Fernandes. So in the end, I think the two components of this session will provide an extra understanding of these issues. So please, Professor João Fernandes, you may start by...
First of all, let me thank you for your kind invitation. It's a pleasure to be here and to accept the invitation of Professor José Calheiros from Universidade from Fernando Pessoa. And also it was a privilege to hear this last presentation that was very actual for our debate right now in Portuguese.
Pode expandir.
Tem que pôr em modo de apresentação o PowerPoint, se não se importa.
Yeah. Okay. So
Obrigado.
I was told that telling that it was a very actual presentation for our last debates on last weeks on racism and migration in Portugal. My presentation for another side is also very actual, because of course we are on a year of elections in Europe, and also a year of a decisive summit of United Nations in New York in September around future rights and future generations. So my presentation is on democratic institutions, the well-being economy, and the rights of future generations. And is from my own experience as a practitioner who is in fact engaged as an active citizenship, fostering and promoting future generations' rights in Portugal, in Europe, and at international level. I will project this first slide that is from Our World in Data, that is a very known project based in the UK around statistics, and who shows our relation as living people with our past, our ancestors, and with our future. And of course, the humanity that is around 8 billion people today is much less than the humanity that already lived and have died. It's around more than 100 billion people, and much, much less than the people that presumably will live after we died. But in fact, our world are in an intersection of very dangerous crises, both climate change, war, and other risks on confrontation at global scales. This is the present, and of course, when we speak about consequences of climate change, is more likely to be more dangerous for next generations, but not only for far away next generation, but for our children, our grandchildren, who certainly can be living on the 23rd century. When we talk about future generations, we are talking about time, and it's very good to travel across time and to see that most of changes in development, in fighting against poverty, or in the health, is a kind of long-term progression and flourishing. In fact, I have here once more two graphics from Our World in Data, one for global child mortality, and we see in 800 more than 40% of child died until the 50 year of anniversary. Nowadays it's of course much less, and we have much good child health in nowadays, and of course the same is valid for poverty, where majority of people in 820 lived with less than 1.19 US dollars, and today only a fraction of people is living under extreme poverty. So when we talk about future generations, we can talk about past generations and the effort that our ancestors have done in order for us to be in a very good shape when comparing with 1 or 2 centuries ago. So the question that we can do like Jonas Salk, that was an American virologist and medical researcher who developed the first successful polio vaccines. One of his question, it was, are we being good ancestors? In fact, I share the opinion of Roman Zarnik, that is a social philosopher who wrote The Good Ancestor book recently, and he will publish in June another book on the history of the long-term thinking. In fact, it was not only the legacy of the polio vaccines that Jonas Salk gave us. It was, I think, this belief that we need to be good ancestors. Of course, Roman Krznaric presents like a fight between short-termism and long-termism. In fact, today we live on a tyranny of clock with digital distraction, political presentism, speculative capitalism, network uncertainty, and perpetual progress based on indicators like GDP, gross development product. But of course, there are experiments along the history that were determinant for our present well-being, that were determined by deep time humility, by legacy mindset, by intergenerational justice, or by cathedral thinking. I live in Lisbon, and of course, Geronimus and other cathedrals that are in our city were not built in 2 years or 10 years or 50 years. Some of the cathedrals were built in more than a century. So it's long-term thinking. And of course, those that strive for the stewardship of our planet believe also in long-term thinking. One of the short-termism is on economics, and not only on the capitalism side of economy, the corporate profit economy, but also on public accounting, because of course, in each year, we need to evaluate the growth of a country. Each 3 months, we evaluate the growth of a company, and in each second, we evaluate, or the algorithms evaluate the growth of the financial transactions in the markets. So I will quote Robert Kennedy, the United States Senator, that it was important, and it was quoted by Wellbeing Economy Alliance, that is a very good experiment at international civil society. And it told, yet the gross national product does not allow for the health of our children, the quality of their education, or the joy of their play. It does not include the beauty of our poetry or the strength of our marriages, the intelligence of our public debates, or the integrity of our public officials. It measures neither our wit nor our courage, neither our wisdom nor our learning, neither our compassion nor our devotion to our country. It measures everything, in short, except that which matters, which makes life worthwhile. So what are the challenges that the institutions in the democracies are facing, especially in Western liberal democracies? The first is, of course, short-termism, that refers to the tendency of democratic institutions to prioritize immediate gains over long-term sustainability. There are 4 main manifestations of short-termism: the infrastructure decay, governments defer infrastructure maintenance, like in hospitals, schools, bridges, and other infrastructures due to high upfront costs. The environment degradation, policies favoring short-term economic growth harm the environment. Health investment, prioritization of immediate responses over prevention neglects long-term health benefits. And unsustainable debt. Governments accumulate excessive public debt for popular programs, and future generations bear the responsibility of repaying this debt. The second challenge are the limitations of traditional economic indicators. The GDP does not account for natural resource depletion or environment damage caused by economic activities. On the social equity, GDP does not reflect income or wealth distribution. And on the quality of life, GDP ignores factors contributing to well-being, such as health, education, social connections, family care, and leisure time. And the third challenge is the influence of powerful interest groups. The lobbying, mainly corporations that have money and resources and knowledge to persuade policymakers to enact legislation that favors their interests. Campaign contributions on elections, donations to political campaigns, grant interests groups significant leverage over elected officials, and media influence. Policy makers may enact policies aligned with bias and misleading narratives promoted by these groups on media. So we need to reform the democratic institutions for the well-being future. There are some features that we can consider that are global features for better institutions to address intergenerational fairness. The first feature is broad mandates. Future generations' interests include more than just environment interests. In fact, here in Portugal, we have already experiences and research since the 80s of the last century that in fact intergenerational poverty exists. And when it happens to have to be a crisis on economic and the welfare system or unemployment, even middle-class families became return to poverty. And this is intergenerational conditions. So we are not only talking about environment, we are talking about also other issues like social welfare, welfare state education, technology, democratic institutions, minority languages, etc. Knowledge and expertise. Future generations' interests can be predicted. The representatives should have the means to adequately access their interests. Motivation, pluralism, and argumentative quality. In fact, we don't know who will be the next generations, how they will live, how will they will think, what will be their preferences. But in fact, if we put our pluralism and references and argumentative capacity, we will be much more likely to be more precise about future foresight and to help, in fact, protect the rights of future generations. Independence, of course, representatives should resist the pressure of short-termism entities. The balance between present and future, of course, there needs to be a framework on intergenerational fairness. We cannot do policies that harm neither future generations, neither present generations. Compatibility with fundamental rights. Representation of future generations should respect current citizens' fundamental rights. On the institutional reforms, we can establish independent future planning bodies like future generations commissioners, long-term planning commissions, implementing well-being budgets like well-being budgeting frameworks that already exist in some countries, well-being impact assessments that are being developed currently, and mandating future generations impact assessments through legislation, through standardized methodologies, and through independent review. But we need, of course, to enhance public participation with public consultations and deliberative forums, consultations, citizens' assemblies, deliberative forums. Education and awareness raising is absolutely fundamental to change mentalities over the short-term thinking. And community-based initiatives like local well-being projects, participatory budgeting, and community-led monitoring and evaluation. We already have some experiments, real experiments in concrete countries, like the Wellbeing Future Generations Act in Wales since 2015. I was just in Wales at the end of April, and we were discussing the experience of the Future Generations Commissioner for Wales. So new initiatives at international level. The first one is an initiative from the Secretary General of United Nations that proposed in 2023 with our common agenda, used to concrete steps to account for future generations' interests inside of United Nations. And this promoting the summit of the future, where we expect to be adopted a declaration on future generations and a pact for the future. In fact, this is already a long-term discussion, because Oikos, and I am the executive director of Oikos, back in 2012, we pushed for an ombudsman on future generations inside United Nations. But right now is the Secretary General that wants to establish an envoy for future generations, and also a forum for future generations to share good practice, best practices of member states of United Nations. In Wales, at the end of April and the beginning of May, we had the opportunity to discuss and to finalize the Wales protocol for future generations, that is about the implementation of the Declaration for the Rights of Future Generations that will be discussed in September in New York. So there is already a proposal from civil society and practitioners on foresight to actually provide some guidance to member states on how to implement the declaration and the pact for future generations. Some key understandings. The first is that future generations are those not yet born, are not only child. Importance of addressing gender rights and disability rights, the value of indigenous knowledge and intergenerational voices, restoring environmental resilience and as a cornerstone. Some proposals and calls for actions. The first one, the first group of recommendations is to people and communities. First, developing collective narratives on future. Second, convening intergenerational conversations. Third, investing in futures literacy. Fourth, establishing participatory mechanisms. And fifth, promoting cultural shift and protecting the commons. For governments and member states of the United Nations, supporting political leaders, encouraging long-term preventative policies, and strengthening parliamentary oversight. Building technical capacities, develop foresight and long-term thinking to ensure intergenerational fairness. Co-creating future prepared policies, And this can be applied to climate change, but also to health, climate adaptation, and to prevent outbreaks like the COVID pandemics that we had in the past. Engaging the private sector, involving the companies in long-term development and hold them accountable, measurement and accountability mechanisms, creating systems to measure progress and ensure sustainable development accountability. But of course, also for multilateral systems and institutions, including the United Nations agencies. So foster the inclusive multilateralism, increasing civil society and youth participation in the multilateral processes, setting a clear strategic direction, planning beyond the Agenda 2030, and addressing long-term trends and plausible futures. We need to bridge the actual 2030 agenda on SDGs, including health-related SDGs, to a much longer term development agenda. Strengthening, monitoring, and evaluating mechanisms to tracking, to make accountable the governments on future-oriented goals. Working regionally, of course, in Africa, in Latin America, in Asia, in Europe, and build resilience to set clear agendas also at the regional level, building capacity and accelerating assistance in order to strengthen foresight capability inside agencies and at the country level. At the European Union, where we will have elections for the European Parliament on the 9th of June. In fact, Oikos is part of a larger and broader coalition in Europe in order to push for an European agenda on future generations that have three concrete proposals. In fact, the first proposal is to have an interinstitutional declaration on future generation rights. The second is to have a commissioner for future generations that can act as a vice president of the commission. And the third one is on future generations impact assessment, improving the actual better regulation guidelines that are already in place in the European Union. As we know, there are already some foresight departments inside the European Commission, even in member state countries like in Portugal. We have Plan APP, that is an interagency and interministerial body that is in charge of foresight. But what we feel is that we are planning on health, we are planning on environment, we are planning on infrastructures, but without a purpose. And I think we need to rediscuss the foresight to have, in fact, a purpose that is the stewardship of planetary and human health for both current and future generations. Thank you.
Thank you very much, Professor João Fernandes. It's a privilege also to hear your developments for the future and the comprehensive presentation on initiatives that are going on and that most of us do not know, including those not yet born. So this is time for us to ask the participants if they have a question, and due to the technical procedures, the questions should be placed on the chat, and then we will identify two questions that will be addressed to our our colleagues. So we will be waiting a little bit for any question. But in the meantime, I may ask something that probably is not quite complete perfect in terms of a round table like this. But I may ask Professor Delan Devakumar if you want to comment on the Professor Fernandes' presentation on the future of the generations, on the future generations, and how it interacts with the idea of social justice, racism, xenophobia, and so on. Is there something that we can get from one talk to the previous presentation?
Thank you very much. And I was thinking through that presentation, I should contact Professor Fernandes. It's fascinating to hear about this work. I grew up in Wales and live on the border of Wales, and I've heard about what Wales is doing, but really not to that extent. So it was really fascinating to hear more about that. I think this links most directly with the current work we're doing on racism and child health. So this is a Lancet commission, and within that, we're thinking about what the major crises are for children in the future. So we have a working group looking at that, thinking about climate change, on conflict and war, on AI and digital health. And so we have these kind of 5 things, pandemics and also migration, and how racism interacts with some of these to result in usually the most disadvantaged people being more disadvantaged by this future event. And so I thought it's fascinating to hear about this work, to hear about the thinking, to hear about how it's hopefully being institutionalized within the European Union, within the United Nations as well. And I'd love to speak more with Professor Fernandes about this, to find out more about this. But I think it very much, very directly relates to that, and particularly thinking about children and their children as well. I've done a little bit of work on conflict and war and how the intergenerational consequences of conflict and war. So these things we're doing now will last a very long time. So we need to think about that now. So thank you for that presentation.
Thank you very much. I would also like to ask Professor Fernandes if he wants to comment on the interaction of his vision and the developments that are occurring, and the concepts that were introduced by Professor Delan Devakumar regarding social justice and eventually making the bridge to the work in the field done by the institution that you are the president, Oikos, in countries that are now also changing their political ways either in Africa or in South America, and also in Portugal. Some of the aspects that were addressed are currently occurring in Portugal. Could you comment on this interaction between your work and the work of your institution and the concepts that were also brought here? Thanks.
Thank you for asking, and I think we can and we must connect each other, because our presentations are very, very complementary and relevant nowadays. And in fact, I was thinking on some of bridges that we can in fact build. As I said, migrations are a very very precise discussion in our societies, and not only in Portugal, but in Europe and elsewhere, and are very, very relevant. But I would like to make a special bridges on a positive level. That is, in fact, I addressed my presentation on the needs for reforming democratic institutions, mainly on Western liberal democracies. Because in fact, I think we should learn in our democracies with other cultures and traditions. In fact, if we see all major religions and all major traditional knowledge in the indigenous peoples elsewhere in Asia, in Africa, and in Latin America, in Australia, etc., we see that, in fact, future generations and the relation with past and future from present generations is very different from our short-termism in Western liberal democracies. So I think, in fact, we have values on participation, on freedom, that, of course, needs to be fostered in our societies. And I think they are a value on human rights, etc. But we need to learn with others. And I think currently, with the migrations, we already can establish not only links through books, but also through people. In fact, some 2 months ago, there was an experience in Lisbon, Future Days, that was organized by a collective of people. And it was very interesting because there was a participation also of minorities in Portugal. And I think it was a collective experience of learning with each other. So I think migration, it's not only an issue to discuss about, but also an opportunity that we need to raise in order to improve our own institutions and processes on democracy. So this is one first observation. The second observation is that, in fact, we live in a polarized world. It's not only the war between states, but it's also inside civil societies and inside the national parliaments. So I think we need to depolarize the discussions and to bring humanity to the discussions. So I think both to discuss the migrations and health, or racism, or xenophobia, or short-termism, we need, in fact, to build bridges. And one of the discussions that we at Troikos always have with other civil society organizations is that we don't need to bridge alliances with concrete parties, but we need to discuss with all parties, from the extreme left to the extreme right, to the far right. So I think we need to discuss with all of them from a humanity vision, a social vision, to discuss racism, to discuss future generations, short-termism, etc. So these are two observations that I would like to have. Thank you.
Thank you very much. It's not usual that speakers interact during the session, but since it's all virtual and we are not going to interact during the coffee break, and also our interaction is important for the colleagues that are attending on the internet. I think this was a very good way of putting you together and hoping for the future. We have one question that it's related to the studies of Professor Delan Devakumar on issues related to gender. If I remember well, you presented data on the COVID and not only by social or racial groups, but also by gender. But eventually you may want to add to something to this question on gender, both by one of our colleagues.
Sorry, can you repeat the question? So I talked about gender in relation to COVID-19.
Your research in the intersectional approach, I would like to know if this research, including the issue of gender, And
Yeah.
I commented that you also had present some information on that.
Yeah. So the one of the early slides on COVID, that's from the Office for National Statistics. So that isn't an analysis I've done. This is what they've done, and I showed their graph. So in our series was 4 papers, and we had one focusing on intersectionality. So yes, gender was a big part of that. In intersectionality, I guess this idea looks at multiple identities that people have. The original work by Kimberly Crenshaw was focusing on gender, on class, and race, particularly focused on Black women in the USA. And what we do see is by gender, you see differences. So this intersection between ethnicity or race and gender leads to different outcomes, different kinds of outcomes amongst the different groups. And that particular paper was case studies, so we didn't have specific statistics around it. So that was looking at experiences of different people, but gender is certainly a very big part of that conversation.
Thank you very much. I'm wondering if there is any other questions from the participants. If not, we must prepare and organize for the session that will come next. But I would just like to say a few words. Today my English is not fluent enough, but I was quite anxious because I did not receive your confirmation that you will be participating. So that explains a little bit what is happening to my language, my speech. So what I would like to say is this is not only a crucial subject or a collection of subjects that must be addressed in an integrated way, and I think that what we have tried to do with the organizers and the other tables that are being organized was to introduce these issues of future generations and what the world is now facing in terms of this dialogue, North-South, climate change, social justice, and many, many other issues. I'm wondering what happened to Sustainable Development Goals. They have gone down the drain, probably. I don't know if the United Nations in September will come with new goals, new set of goals, or saying from the millennium to the next millennium. But from my point of view, what we need is action, and action is getting together and working together. And I think with this, I'll finish. But before finishing, I just want to confirm that you feel free, you feel comfortable if we have taped this session, and if this session could be available in our internet YouTube platform. Please just let me know if you have any comments that you don't want this to be developed. Just let me know. Are you comfortable, Delan?
Yes, that's fine.
Yeah, we are all teachers, and we must share our knowledge, and eventually people would like to revise some of the tables and the concepts. And let's finish with a word of hope for the future, and think that the Kennedys did not finish their job, and look at what happens, what's going on in America and in other countries. Let's think that it will be possible to recover from that loss, and also that our countries will improve in these issues, and treat migrants and other communities as equals as we should do to everybody. Thank you so much. On behalf of all of my colleagues in the organization, I would like to convey my thanks to you, and just announce before closing that we will have now a break here, a real break downstairs for probably the table. I thank Rui and I thank Elsa for being here with me with the technological support, and also you. And the next session will be societies, technologies, and artificial intelligence. It sounds that artificial intelligence is going to save us all from all the evils, but we will be aware. Thank you so much. All the best, and thank you from the bottom of my heart. Thank you.
Thank you.
Bye-bye.
Thank you.
Professor Delan, I will contact you. Thank you.
Bye.
Bye.